Right, continuing the discussion on the COVID-19 vaccine and the importance of staying informed. As you ask, we answer.
Yeah, we are once again joined by Trinity Health in New England's Dr. Syed Hussain to give us a lowdown on this. Dr. Hussain, good morning. How are you today?
Morning, I'm great. Thank you for having me.
Glad to have you here. And boy, is there a lot to talk about. Now, it bears repeating, already about close to 2.4 million Americans have gotten a third dose. So we have a lot of data to work with here. But what are we expecting to see with regards to side effects from the booster shots? Are they going to be as strong the third time around as they were for some people after their first and second doses? Are there any new side effects or safety concerns?
So I'm going to review data that Pfizer submitted to the FDA for this booster shot, and that included 300 individuals, out of which the most commonly experienced side effects were fatigue in more than 60% of study participants, followed by headache and muscle ache. So, and they were mild to moderate in intensity. And what I tell folks is that these side effects pale in comparison to what moderate to severe COVID-19 disease can do to us.
All right, Doctor. So the CDC director overruling her own advisory board and sided with the FDA in deciding that frontline workers should also be covered. What do you say? Do you agree with that decision?
I do, because it aligns with the FDA, which also looked at the data, and it removes any confusion or apprehension that folks may have. So it's important that we are aligned, that the CDC and FDA work closely together. There are three buckets of individuals, if you will, that are now eligible for the booster: 65 and above, those individuals with underlying medical problems, and folks such as healthcare workers who may experience COVID-19 or be at higher risk for contracting COVID-19 because of occupational risk.
I want to move off from boosters just for a quick second, Doctor, and talk about kids aged 5 to 11. Maybe in the next couple of months, they could be authorized for their vaccines. But as you know, and as you said, this is by far the group that is the least likely to die or to suffer severe complications from COVID. So a lot of parents may be asking, why should I get my kids the shot? What do you say about that?
So yes, while it's true that since the start of this pandemic, children have been shown to be more resilient, but we've seen a higher number of pediatric cases across the country with the spread of the Delta variant. So just to give you a couple data facts. So 1 out of 5 COVID-19 infections currently are in children. And the month of August saw a record 30,000 pediatric hospitalizations. So while infections have remained lower, they have gone up over the last several months. And we don't want our children to come down with moderate to severe COVID-19 disease or complications related to that. So that's why it's really important that when authorization comes through, and we expect that by the end of October, especially starting with Pfizer, because they are in the process of submitting data to the FDA, it's important that we get our children vaccinated.
Trinity Health of New England's Dr. Syed Hussain, as always, we appreciate your insight, and please come on back.